Hello, I am Dr. Sampurna Ghosh, ENT consultant in Medicover, Hyderabad. Today I am going to cover a very common topic which is nose block. Myself being an ENT surgeon, I get majority of cases of nasal symptoms of different age group of people starting from a neonate newborn baby to a teenager to an adult and also the geriatric age group. So I just wanted to focus a few common causes of nose block. Let us start with the kids. So, in children, a common cold is obviously the most common reason of nose block, which can be treated with over the counter medicines like saline nasal drop, which is very safe for the baby. Anybody can use that for prolonged time, there will be no harm. There are decongestant drop like xylometazoline, oxymetazoline. These drops are for temporary relief. They can be used at a time for 7-10 days, but they shouldn't be overused. There are anti-allergic medicines and all. What are the other reason for a child to have chronically blocked nose? Suppose a child is taking breathing through mouth, there is noisy breathing, snoring, then the parents or the pediatrician should suspect that it is something beyond common cold. Nose block should not persist throughout the year without any reason. Most common, the children suffer from adenoid hypertrophy. Adenoid is a lymphatic structure which lies behind the nose. So, where this nasal passage is ending and the throat is starting, in that angulation, it hangs like a bunch of grapes. So, this is a normal structure of the body, but in few kids, the size become so huge along with the tonsil that the child cannot breathe properly, and there will be episodes of choking, lot of sleep disturbance, the child don't grow properly. It can also affect their physical and intellectual growth. Coming to the adult part, in adult, chronic nose block can be from DNS. What is DNS? It is deviated nasal septum. Imagine this is the cross section of nose, simplified if I draw like this structure, and we have a partition wall which divides the nose into left and right. So they are basically two tunnels. Where the tunnels are ending, they are conjoined. Now they become single tunnel and continue in the throat. Now this structure is called septum. In many people, the septum is not straight like this. It may be like this with an angulation to any one side, or it may be like this with a convexity or concavity to one side. If this problem is there, it is called DNS or deviated nasal septum. In few people, if it is a mild deviation, it may not cause any issue, but if it is a gross deviation, then there will be chronic nose block. What are the other reason is turbinate hypertrophy. What is turbinate? From side wall of nose, we do have structures like this. Everybody have this. This is not a polyp or an extra growth. This is called turbinate. Now imagine if the turbinate size is very huge, then what will happen? So the turbinate, if it is like this, so obviously what happens, the air space gets narrow. The air is supposed to flow between this and this. Now this guy taking up so much space, the air space becomes very narrow, causing stuffiness in nose and chronic nasal obstruction. Other than that, can an adult suffer from adenoid hypertrophy? Yes. If the adenoid has not been diagnosed and taken care in the pediatric age group, it will linger in the adulthood and will cause nose block. The other reasons are sinusitis, chronic infection of the sinuses. They will cause lot of thick secretion coming down in your throat. They can cause foul smell or loss of smell, and they can cause pain around these areas, nose or forehead, and of course nose block as well. Sometimes when we structurally check, suppose all these factors are normal, still the adult is complaining of nose block, we may also have to evaluate whether there is any acid reflux. Acid reflux can cause lot of nasal symptoms in adults, and also think about where the person is living. So if somebody is born and brought up in a humid country and shifted to a dry climate or to a very cold climate, the nose may react accordingly. So environmental factor, lifestyle, everything is also important for adult nose block. Now, what if we don't treat the nose block, or how it can cause long-term issues in the health? Let us discuss that. So the primary consequences, of course, see, breathing, eating, drinking, these are our basic need of the life, which should go without any hindrance very smoothly. We should not be bothered about that. But when there is nose block, obviously the body is struggling to get adequate amount of oxygen. So nose being such a tiny little organ in the body, but it does immense role. So only this whole body needs oxygen. That oxygen goes only through the small passages present here. That is the beauty of the mechanism. So of course, if this passage is blocked and you are not getting smoothly enough amount of required oxygen, it is going to hamper your daily life. There will be sleep issues, knowingly or unknowingly. Sometimes the patient cannot describe, but when I ask leading question that how is your quality of sleep, what do you feel when you lie down on the bed, then they open up that it's very difficult to fall asleep because the nose is blocked. I keep breathing through the mouth, which causes secondary sore throat and recurrent throat infection as well. Now, mouth breathing. Mouth breathing is very serious issue, especially in kids, because if a child is not breathing through the nose, this portion of the face will not develop properly. The facial development of maxilla especially depends on airflow through the nose. Nose is for breathing, mouth is for eating. It cannot be reversed. It is not physiological at all. So chronic mouth breather will have lot of problem in the orthodontics, like the tooth will be crooked or they will be overriding. These children end up with the dental treatment, sometime knowing or not knowing that the problem started from the nose, which must be treated. So a good orthodontist will always refer to ENT that check whether there is any nose block issue or not. What else can come from nose block is snoring. Snoring is not a joke. You have to understand that. Now, mild snoring, occasional snoring, if a person is very tired or took alcohol, that's okay. But every night somebody snoring like a lion or having gasping spells at night is really dangerous, which is actually features of a disease called obstructive sleep apnea. I will not go into the details of this because I have lot more videos on that, but just remember that nose block can also lead to OSA, which is not really good for your heart and brain. What else can happen? Chronic infections in sinuses, which can lead to other complications, which can even go into the eyes and brain because sinuses are related to these vital structures. And of course, recurrent URTI. URTI means upper respiratory tract infection. In common man term, there are people who tells me, oh doctor, every alternative day I feel something is dribbling in my throat. Every month I suffer from sore throat, nose block. They end up taking lot of antibiotics. That ultimately causes lot of being absent from school or office, and they don't feel energetic. So that leads to poor quality of life. So it's a broad topic, but ultimately the take home message is that if you are suffering from chronic nose block or your child is suffering, children cannot say. It is the parents' duty to observe and notice. If the child is having recurrent or chronic nose block, you better visit an ENT doctor because the cause can be varied. One person may have allergy, which can be treatable only with medicine, but some other person can have DNS, which may need a surgery. So it is tailor-made treatment. Depending on the cause, the good ENT doctor can give you the exact treatment, but it should be treated because nasal breathing is something very basic in our human body and normal physiology. Thank you.